and welcome to WellFit Wisdom, the podcast for those looking for practical advice on improving their overall well-being, with a specific focus on physical fitness and complementary topics. I'm Eric Rothstein. In this podcast, I'll bring my learnings, experiences, and exploration from my own 25-plus year fitness journey, and from helping others achieve their wellness goals at my fitness studio in the suburbs of Philadelphia. So let's get started. In this episode of WellFit Wisdom, we look at the causes, prevention, and treatment of lower back pain. For that discussion, I'm pleased to welcome Scott Barnes to the podcast. Scott Barnes is a physical therapist and multi-site clinic director at ATI. He's a board-certified orthopedic specialist in physical therapy and certified in orthopedic manual therapy. Scott, welcome to WellFit Wisdom. My first question for you is, what are the main causes of lower back pain?
Thank you, Eric. So there are quite a few causes of low back pain. The back is very complex. It's made up of individual bony vertebrae with nerve, ligament, and lots of muscle attachment. So a lot can happen. Aside from the occasional traumatic injury, most common causes of low back pain that I tend to see in clinic are due to poor or improper lifting technique, repetitive bending activity, sedentary lifestyle, and a routine of really just kind of sitting for long periods throughout the day. So if you have like a desk work job or something like that. And of course, not being active or exercising enough. So all these things tend to promote usually a muscle imbalance, which over a long period of time, if it's not addressed, will lead to other issues and low back pain.
Thanks, Scott. The next question is, what advice do you have for people to avoid lower back pain?
So the easiest thing to do is just getting up and being more mobile, moving. Research shows that simply walking is one of the best ways to address chronic low back pain. Leading a more active and healthy lifestyle by participating in exercise such as yoga, Pilates, core and glute strengthening activities, and reducing time spent sitting will all have a positive impact on alleviating low back pain. Of course, if these things are not working and you're not really seeing any relief, or the back pain is more acute or due to an injury, then physical therapy or seeking out an orthopedist should be considered.
Got it. So for people with lower back pain, how should they decide whether it requires rest or treatment, or whether it's something they can actually work through?
So there are a few things to consider. Some of those are, whether or not it's an acute injury, like a trip and fall, or some sort of an accident. Is it more of a chronic pain issue that you've had before and it tends to come and go every so often? Are there any other symptoms like weakness or pain down one or both of your legs? Things of that nature. So typically, if it's a more acute injury, as mentioned in the last question, PT or a consult from an ortho should definitely be considered. If it's more of a chronic reoccurrence of low back pain, active rest for a few days is definitely the way to go, followed by a gradual return to normal activity and normal activity levels if the pain is subsiding. So by active rest, I'm not really referring to laying on the couch or these sedentary type behaviors. Instead, what I mean are periods of rest with gentle, tolerable stretching and activity intertwined with some periods of rest to alleviate that pain. Of course, if the pain is not improving, then physical therapy again can be considered. At ATI, we do have free injury screens. So if someone is in pain and they're just not sure if it's okay to work through it or go back to their prior activity level, we can certainly help provide some guidance there.
That's great, Scott. So last question. As a physical therapist, what are the main ways you address lower back pain?
So every patient is a little bit different. Even the patients that walk through the door with the exact same diagnosis, they're going to have a different presentation little nuancy things that are, different from everybody else that makes their case specific to them. So as a PT, it's my job to find these specific deficits and limitations that are contributing to or causing the low back pain. Once we find and address these limitations, we work to restore normal, natural motion through stretching, strengthening specific targeted muscles, providing hands-on joint mobilization techniques and manipulation techniques, and also educating and empowering our patients to assure their understanding of their specific back pain issue and also prevent future reoccurrence.
Scott, thank you for sharing your wisdom and your thoughts with us today and for helping our listeners continue their journeys to a well-fit life. Thanks for joining WellFit Wisdom today. Remember, the 5 pillars of wellness include the 3 pillars of fitness: cardiovascular conditioning, strength training, and flexibility, and then add a pillar for proper nutrition and hydration, and a pillar for sleep and stress management. That's the key to building a well-fit life. See you next time.